Hello, welcome back to our channel. In this video, we will be talking about cerebrovascular accident. The medical emergency known as a cerebrovascular accident, CVA, also referred to as a stroke, is characterized by an abrupt interruption of blood flow to a portion of the brain, resulting in tissue destruction and neurological impairments. Effective management and prevention of strokes require a thorough understanding of the pathophysiology, signs and symptoms, diagnostic tests, available treatments, nursing interventions, and patient education. Pathophysiology. There are two main mechanisms involved in the pathophysiology of a stroke. We have ischemia stroke and hemorrhagic stroke. Ischemic stroke. This kind of stroke happens when a blood vessel supplying the brain becomes blocked, depriving brain tissue of blood flow and oxygen. A thrombus that forms locally in the artery, or an embolus, or clot that moves from another part of the body and lodges in a cerebral artery, can both be the cause of the obstruction. Systemic hypoperfusion, a widespread reduction in blood flow to the brain frequently brought on by low blood pressure or heart failure, can also cause ischemic strokes. 2. Hemorrhagic stroke. Hemorrhagic strokes happen when a weak blood artery bursts and blood flows into the subarachnoid space that surrounds the brain, subarachnoid hemorrhage, or into the surrounding brain tissue, intracerebral hemorrhage. The brain tissue is compressed as a result of this bleeding. Larger portions of the brain may be affected, and it is more severe and destructive than other cerebrovascular accident, CVA. Signs and symptoms of a stroke. Depending on where and how much brain tissue is injured, as well as whether the stroke is hemorrhagic or ischemic, the signs and symptoms of a stroke will vary. Common indications and manifestations consist of abrupt numbness or weakness or tingling in the face and arm, particularly on one side of the body. Abrupt disorientation or difficulty speaking or comprehending speech. Abrupt difficulty seeing in one or both eyes. Abrupt difficulty walking, vertigo, loss of balance, or coordination. Sudden severe headache without apparent reason or unsteadiness. Nurses should report such sudden changes to the doctor immediately, because immediate medical treatment may prevent permanent brain damage. Quicker treatment and better results can result from teaching patients and their families how to identify the warning signs and symptoms of a stroke and the significance of getting help right away. Stroke risk factors. Patients can lower their risk of stroke by changing their lifestyle by learning about modifiable risk factors, such as diabetes, hypertension, smoking, history of arterial fibrillation, history of TIA, hyperlipidemia, obesity, and physical inactivity. Promoting good lifestyle practices that lower the risk of stroke and enhance general health include regular exercise, a balanced diet low in saturated fats and sodium, quitting smoking, and moderation in alcohol consumption. Diagnostic tests. Diagnosing a stroke promptly is crucial for initiating appropriate treatment. Diagnostic tests include diagnostic imaging. A computed tomography, CT scan, is frequently the first imaging test carried out to determine the degree of brain damage and to differentiate between ischemic and hemorrhagic strokes. It is good to note that magnetic resonance imaging, MRI, is preferred diagnostic test because it offers sharper pictures that helps to determine the cause of the stroke, and it is also capable of displaying tiny strokes that a CT scan may not show. Blood tests. To determine blood sugar levels, clotting time, and lipid profile, all of which might reveal information regarding stroke risk factors, blood tests may be performed. Electrocardiogram, ECG. To evaluate cardiac rhythm and locate possible emboli sources, an ECG may be carried out. Cerebral angiography. To see any anomalies such aneurysms or arterial stenosis, this invasive treatment involves injecting a contrast dye into the brain's blood vessels. Treatment options. The goals of stroke treatment plans are to limit complications, stop more brain damage, and restore blood flow to the affected area. The kind, origin, and duration since the beginning of symptoms all influence the therapy option. Thrombolytic therapy. To break up clots and restore blood flow following an ischemic stroke, tissue plasminogen activator, TPA, may be injected intravenously. For this treatment to be effective, the beginning of symptoms must occur within a time frame of 3 hours, but initial screening to rule out hemorrhage or other contraindications for anticoagulant must be done. Mechanical thrombectomy. A catheter-based technique may be used to physically remove the clot from the obstructed artery in certain circumstances, especially those involving massive arterial occlusions. Antiplatelet and anticoagulant therapy. By preventing blood clots from forming or expanding, these drugs lower the chance of another stroke. Surgery. To repair the blood vessel and stop bleeding again, surgery may be required in cases of hemorrhagic stroke brought on by aneurysm rupture or arteriovenous malformation, AVM. Rehabilitation. After the acute stage of care, patients can enhance their quality of life and regain lost function with the use of physical therapy, occupational therapy, speech therapy, and cognitive therapy programs. Nursing interventions. In the acute period of stroke patients' treatment, as well as during their rehabilitation, nursing care is essential. Among the nursing interventions are assessment. To enable early change detection and timely intervention, routine evaluation of neurological status, vital signs, and indications of complications is necessary. Monitoring. It is possible to detect and treat potential problems including arrhythmias, hypoxia, and dehydration by regularly monitoring heart rhythm, oxygen saturation, and fluid balance. Placement. Appropriate placement helps avoid issues including aspiration and pressure ulcers. This includes elevating the head of the bed and repositioning frequently. Mobility assistance. Implement fall precautions, support for daily life activities and mobility to prevent muscle atrophy, contractions, prevents deconditioning, and encourages independence. Medication administration. It's important to carefully check for side effects and therapeutic response while administering medications as prescribed, such as thrombolytic, anticoagulants, antihypertensive, and anti-epileptic drugs. Do not administer clot-busting agents to patients with hemorrhagic stroke. Assess for gag reflex and ability to swallow before giving oral medications or food. Recurrent strokes can be avoided by making sure patients understand the significance of taking their prescribed drugs as directed, such as anticoagulants, antiplatelet, and antihypertensive. Education. Patients and their families can take an active role in stroke prevention and management by being informed about stroke risk factors, warning signals, medication management, lifestyle adjustments, and community services. In order to promote the best possible recovery and prevent repeat strokes, patient education is crucial. Conclusion. To sum up, effective management and prevention of strokes require a thorough grasp of the pathophysiology, signs and symptoms, diagnostic procedures, available treatments, nursing interventions, and patient education. Healthcare professionals can help optimize outcomes and improve the quality of life for stroke survivors by timely recognition, effective treatment, and continued support. Stressing the value of routine follow-up visits with medical professionals for continued stroke risk factor monitoring and control, as well as rehabilitation aids in long-term healing.